So, Mike and Lori, what are some of the symptoms of depression that we should look for, especially how to distinguish between fatigue related to IBD and fatigue that might be related to depression? I know there's a lot of overlap. Can you tell us a little bit more about this topic?
Yeah, sure. I mean, I'd be happy to. Obviously, we do have sort of a formal way of diagnosing depression, right? Through, formal diagnostic criteria that includes things like depressed mood and loss of interest in activities that were previously enjoyable. And for most people, those are sort of the hallmark features of depression. Um, but when you in the setting of chronic disease, you also have other symptoms of depression that overlap a little bit, and maybe Mike can talk a little bit about that in a minute. But we kind of have three other symptoms make up that diagnosis. So you could have any number of fatigue, sleep difficulties, um, changes in your appetite or your weight, either up or down. Some people eat more when they're depressed. Some people eat less when they're depressed. Same thing with sleeping too much or too little, feeling like it's hard to concentrate or make decisions. And I also think there's the cognitive component, which are feelings of worthlessness, feelings of guilt. And in my IBD patients, I see a lot of just not wanting to burden others. No one wants to be around me when I'm sick, or I'm not any fun anymore. I don't want to have to, put on a happy face anymore. I'm tired of faking it. And so I think it's sort of that combination of the depressed mood, maybe for some people that's irritability, or just crankiness, but that loss of interest in activities coupled with, a smattering of these other symptoms. For everyone, it kind of manifests differently. For me, I'm the most concerned when patients start to shift from just feeling low mood and fatigued and maybe some difficulty sleeping to those cognitive symptoms of I feel worthless, I feel like I'm a burden, I feel hopeless. I think as a psychologist, that's when I'm able to sort of distinguish what's going on here above and beyond, the fact that the person's on prednisone or really inflamed or really feeling bad, to an actual shift in your thought process and in an actual shift in your sense of self and self-worth.
I think from the gastroenterologist's perspective, it really is quite important to emphasize, some of the more subtle findings of depression and just how much they actually overlap with symptoms of IBD itself. And again, I think the low level of fatigue, the difficulty with sleep, the weight changes, and particularly weight loss or appetite related changes, and even some of the more GI symptoms like pain and abdominal pain. Depression hurts, and I think as a gastroenterologist, when we partner and work with patients, we really do need to sort out how much of the symptoms may be due to the IBD, and be on high level of alert that many of the symptoms may be due to depression itself. And often it's actually a combination of the two. And I think there are a lot of implications for management and treatment, because if we focus on the IBD and not the depression, we leave something out. And if we focus on depression and not the IBD, we also leave something out. And what we really want to do is focus on the complete patient and the interaction of those factors.
Mike, do you think this is something that a lot of gastroenterologists are aware of?
I do think gastroenterologists are increasingly aware of that mind-body connection, and really how many of the symptoms of depression can overlap with the symptoms of inflammatory bowel disease. But this is certainly an emerging area, and I think to me it underscores the importance of patients to really communicate well with their physicians. And, if patients think that they may, or even are questioning whether there may be some anxiety or depression and how that may be impacting their symptoms or even their IBD disease activity itself, I think it's important for patients to feel comfortable bringing up the topic as well. In a busy clinical practice and with a short time allotted for many office appointments, often these discussions won't happen unless patients actually feel comfortable initiating them with gastroenterologists. Gastroenterologists aren't always able to tease them out and aren't trained as well as psychologists to ask just the right questions at just the right time to tease that out. But I can guarantee you that that all gastroenterologists are sort of primed and ready to begin to sort of put together that complete mind-body picture if and when it comes up in the context of an office visit or a phone call.